Hi, my name is Erica Blasque. I'm the Community Outreach for the Campus Health Center at Wayne State University. Today we're going to be talking about PrEP during the time of COVID-19. We're going to talk a little bit about what HIV is, what PrEP is, and how you can get PrEP during the time of COVID. So we'll start with what is HIV. HIV stands for the human immunodeficiency virus. It's a virus that attacks the cells that help the body fight infection. These particular cells are called CD4 lymphocytes. HIV is treatable, but it's not curable, and there is no available vaccine at this time. There are a few different types and strains of HIV, mainly HIV-1 and HIV-2. HIV-1 is what we typically see in the United States. So having another STI does increase your risk of getting HIV by about 3 times if you are exposed to it while you have an active STI infection. This is because you can have inflammation and things going on that can increase your susceptibility to picking up HIV if you're exposed to it while you have another STI. So that's why regular testing and then getting treated right away if you have an STI is very important. HIV is spread by coming into contact with blood or certain bodily fluids from a person who has HIV. It is spread by bodily fluids such as vaginal and anal secretions, not by things like saliva. So no, you cannot pick up HIV from a toilet seat, sharing towels, sharing cups, things like that. But what happens when someone gets HIV is it lowers their immune system, so they become more vulnerable to other diseases. So things that may make somebody who doesn't live with HIV, it doesn't really affect them too much, may make somebody who's living with HIV very sick. A lot of times these are called opportunistic infections, which is what happens in people who normally can fight them off, may actually make someone with HIV very sick. So these are pneumonias, certain types of cancers. You may have heard of Kaposi's sarcoma, which is one of the main ones. Also fungal infections or candidiasis, like yeast infections, can be very serious in people who live with HIV. There are 3 stages of HIV. Stage 1 being acute HIV infection, which is what typically brings people in to get tested. They may experience flu-like symptoms, swollen lymph nodes, things like that. At this time, the person is highly contagious to others, and they do have a high viral load, which means many copies of the virus in their blood. So at that point, they can move on into chronic HIV infection, where somebody may live for many years, not showing symptoms, but still can transmit the virus to others if not treated. Nowadays, with current HIV treatments, people can live with chronic HIV infection and have a very normal, healthy life, especially when they're taking the treatment regularly and the treatment is effective. They can actually go into undetectable levels of viral load in their blood. And the state of Michigan does support the fact that if you are undetectable, you are untransmittable, meaning if you have a low enough viral load in your blood where you're so low you're undetectable, you actually can't transmit the virus to someone else. Stage 3 is when you're going into AIDS, acquired immunodeficiency syndrome. At this time, you're back into having a high viral load, you're highly contagious again, and you're very susceptible to those opportunistic infections we talked about. And if you don't seek treatment, life expectancy is about 3 years. So AIDS is what happens when somebody lets their chronic HIV go untreated, or if they don't have an effective treatment regimen, you can go into stage 3. And to the right here is what the HIV virus looks like. So what is PrEP? PrEP stands for pre-exposure prophylaxis, which means you're taking this medication to reduce the risk of contracting HIV before you can become exposed. So you're basically preparing yourself for exposure, and you're taking this medication to provide that layer of protection before you become exposed to it. To do that, you take a pill every day by mouth. You can take it with or without food, but you must take it every day to have the maximum protection. In Michigan, it is only available from a healthcare provider. You must have a prescription for it. And what this medication actually does is it helps HIV not take hold in your body and then spread and make copies of itself if you're exposed to it. And so how effective is it? Studies are showing that PrEP can reduce the risk of someone getting HIV from sex by about 99% when taken daily. These numbers are actually better with regular condom use. For among people who inject drugs, PrEP reduces the risk of getting HIV by at least 74% when taken daily. So we know that this medication is effective. There are two medications in the US that are licensed for PrEP, Descovy and Truvada. Both medications do not protect against pregnancy or other STIs, and so that's why if you're concerned about getting another STI, condom use is still recommended while you're on PrEP, because it does not provide that layer of protection against other STIs. Why is PrEP important? Because for new HIV diagnoses, the highest rates are in individuals aged 25 to 29. A fifth of new diagnoses occur under the age of 24, and 50% of people who have a new diagnosis of HIV have been treated for another sexually transmitted infection within the last 6 months. So the numbers support PrEP being important, especially in this age group. And then also for partners where one person is HIV positive, one person is negative, and they're trying to prevent the HIV negative person from becoming HIV positive, PrEP is a good bridge for when the HIV positive person is still trying to get their viral load down to undetectable levels. And they say it may take up to 6 months for that to happen. So it's a good way to kind of bridge that gap for those couples. So we'll talk a little bit more about the two medications that are licensed for PrEP. Number one being Truvada, also known as FTC-TDF, which is the actual medication that's in Truvada. This is for adults and adolescents who are at risk of getting HIV-1 and weigh at least 77 pounds. It is not recommended for people with kidney function below a certain level. There are some possible common side effects such as stomach pain, headache, and weight loss. Less common or uncommon side effects of Truvada might be bone issues. So there has been noted bone pain, softening, or thinning with the use of Truvada. However, studies do show that there is no increase in bone fractures, and it actually does reverse after the person discontinues PrEP or discontinues Truvada. And people may experience rarely kidney problems or liver problems. The second medication, Descovy, also known as TAF-FTC, this is for adults and adolescents who are at risk of getting HIV-1 and weigh at least 77 pounds. But it is not for people who are assigned female at birth, who are at risk of getting HIV from vaginal sex, because its effectiveness has not yet been studied for vaginal sex. Possible common side effects for Descovy are stomach pain or nausea, diarrhea, headache or fatigue, also known as tiredness. Other uncommon side effects are kidney problems and liver problems, and studies are showing less impact on kidney function and bone loss than with Truvada. So who might consider taking PrEP? PrEP is for people who are currently HIV negative, and you must be HIV negative. And if you do things like injecting drugs or you share injection equipment with others, if you have sex with people who inject drugs, if you have sex with people who are HIV positive, especially if you don't know what their viral load is, or if their viral load is still detectable and you don't want to become HIV positive yourself, this is a good extra layer of protection. If you have unprotected sex with people of unknown HIV status, such as anonymous partners or somebody that you might have met off an app, you might want to think about this. If you exchange sex for drugs or money, or if you engage in vaginal or anal sex within the last 6 months and you have had an STI within the last 6 months, you might want to consider PrEP. That just goes back to that 50% of new HIV diagnoses being in the population that have had an STI within the last 6 months. This is why. So how can you start the conversation with your healthcare provider about starting PrEP? Number one is be clear about your interest in starting PrEP and that you want to get more information. You can just directly ask, hey, I heard about PrEP. I'm interested in starting it. What do I need to know? Bring with you a list of your medical history to your appointment. That includes your past diagnoses, illnesses, and surgeries, any medications that you take, any supplements or herbals that you take. Be honest about your sexual history and practices. This is important. You actually can, there's an HIV risk reduction tool that you can access on the CDC website, which kind of helps explain what are your risk factors in your life that might encourage you to take PrEP for that extra layer of protection. Your healthcare provider is there to keep you safe, answer your questions, and not to judge. They just want you to be able to live your life in the safest way possible and continue to do what makes you happy in a safer way. Wanting to start PrEP does not make you quote unquote dirty or promiscuous or anything to be ashamed of if that's your concern. It just means that you're taking charge of your health. If you're nervous talking about your sex life, lead with that. Be honest with your doctor. Hey, I'm nervous talking about my sex life, and then your doctor can help take it from there. Ask about easy ways that you can add PrEP to your normal routine. If you set your alarm to get up at 7:30, you know that as soon as you get up, you take your PrEP. Or you put it by your toothbrush, and when you brush your teeth, you gotta take your PrEP. There's ways that you can slide in PrEP into your normal routine that hopefully will make the transition very easy. PrEP is only good as how consistently you take it. It's very important that you take it every day to achieve that maximum level of protection. And if you're interested, you may discuss other options for reducing your sexual risk factors with your doctor. What condoms should I be using? How should I use them? What am I forgetting about? What are my other risks that I might want to worry about? And don't be afraid to interrupt your provider when you need further clarification on a topic. If your doctor continues to talk and you don't understand, don't be afraid to stop them and say, hey, can you repeat what you said about that? Or can you explain more about that and how it affects me? So here's the website for that risk reduction tool, hivrisk.cdc.gov. And that might be something that you could take with you to your appointment. So what to expect when starting PrEP? At your initial appointment, your healthcare provider might order some tests. Number one is going to be HIV. You have to be HIV negative to be on PrEP. They may also order hepatitis B, kidney function tests, baseline liver function tests. They may test you for other sexually transmitted infections at that time. And for people who have childbearing potential, they may test you for pregnancy. They're going to want to assess your vaccine history, make sure that you're caught up on your vaccines. And then you're going to have to follow up with your healthcare provider every 3 months to test for HIV. They may check your kidney function every 3 to 6 months, and they may test for other STIs every 3 to 6 months, depending on what you and your doctor decide as your best window for that. Is PrEP safe? Yes. No significant health effects have been seen in people who are HIV negative and have taken PrEP for up to 5 years. That's from hiv.gov. The side effects from taking PrEP are usually not serious and go away over time without stopping PrEP. That's also from hiv.gov. And most side effects resolve within a few days and almost never last more than a month. And that's from the World Health Organization. So if you're worried about that nausea, that fatigue. They say that it should resolve within a few days, and most people don't have it last more than a month. Almost never lasts more than a month. More studies are needed on the topic of PrEP interfering with transgender hormone therapy, but at this time, there are no known drug conflicts or interactions between taking PrEP and the hormones at the same time, and PrEP can be taken with all contraception methods. So how do we pay for PrEP? Most Medicaid plans and private insurances cover PrEP. They may require prior authorization, which your doctor can help you with. There are medication assistance programs to provide free medication or help with co-pays. They may not help with assistance with clinic costs or lab fees, so that may be on an individual basis with your particular clinic. Maybe they can put you on a sliding scale fee plan if you're uninsured or underinsured. And here's a few resources: getyourprep.com, Gilead, advancingaccess.com, Patient Access Network Foundation, PAN Foundation.org, Patient Advocate Foundation, copays.org/funds/HIV-AIDS-and-prevention, and Ready Set PrEP, which is the federal program. There is a cost calculator you can use at prepcost.org, which can help give you an idea of what you might have to pay out of pocket. So what does COVID-19 mean for PrEP, especially when I mentioned that you may need to go in every 3 months for follow-up testing? Well, CDC wrote a guidance letter to clinicians to help their patients through PrEP during this pandemic. CDC does consider PrEP to be an essential service, and they do want the providers to continue HIV testing every 3 months, because if you become positive for HIV, you must discontinue PrEP. This is to decrease the risk of resistance of HIV to PrEP in the population. There are things such as home specimen collection kits, even oral self-swabbing that you can do, that your doctor can order. There's also telehealth and phone consultation visits with the provider. And studies are showing that 95% of people are still able to get PrEP in this way. So if you're concerned about coming into the clinic, these are ways that you can continue your program at home. Healthcare providers are encouraged to consider giving you a 90-day supply of the medications so that you can reduce your trips to the pharmacy. And as of July 7th, 2020, which is the most recent data, there are no shortages or concern of shortage with the medication used for PrEP, so don't worry about that. Yes, you can get PrEP at the campus health center. We can start you on PrEP and manage your follow-up visits and testing. You do get 1 free visit per semester while enrolled as a Wayne State student. So that's a general visit. You get 1 general visit per semester while enrolled. We also do full primary care here, including vaccinations, physicals, and illness care. You can get your flu vaccine here for no out-of-pocket cost, regardless of your insurance status. We offer free STI testing for those who qualify, so you can give us a call and find out if you qualify for that free testing. We're doing a lot around here to stay COVID-19 safe. We're wiping down surfaces, wearing masks, socially distancing, you name it. And then if you're interested, you can go through the Dean of Students office. There is a student organization called Warriors PrEP and PEP Awareness, and you can go through DOSO for more information on that. So thank you so much for joining me for this webinar. Feel free to contact us. There's our address and phone number. You can email us. We do have anonymous question email. You can just go online to Ask the Experts on our website, and it sends me your question completely anonymously. You follow us on social media, our Twitter, our Facebook, our Instagram, and we do offer telehealth visits as well, so you can just do it by phone or over webcam. Happy to help you that way. So thank you so much for joining me. I hope this was helpful. Email us anytime you have a question, and stay safe.